So today I wanted to talk through how decompression works. So we're going to start offering decompression as a modality at the office in addition to adjusting. So the protocol will go, you will get decompression first, which is going to kind of elongate the spine and decrease pressure, which is going to allow our adjustments to be more effective. So let me give you the rundown on decompression so you understand kind of the gist of anatomically how it works and then also the benefits that you'll see from this modality. So how decompression works, it's basically going to be focusing on disc health. So the discs which are loaded in your spine, when you're working all day and you have a loaded spine, gravity is constantly pulling and decreasing the space between your vertebra. That little pad that sits between each vertebra is called a disc. That disc, when it has too much pressure over time, will start to wear on the nerves around it. It will also start to feel like that tension type pressure where you just feel like you're all crunched up. This decompression is exactly focused on that sensation and how to decrease that discomfort. So the disc health, what we're going to be focusing on is assisting a process called imbibition. So the discs in your spine do not have any nutritious flow via the circulation. So there is no circulation flowing through those discs to keep them healthy and plump. The purpose of blood is to bring nutrients and to flush out waste and get rid of inflammation. So since we don't have that process, we're requiring that imbibition process. What imbibition needs is movement and hydration. So the decompression is going to create space to allow the joint to have more mobility so that it has a higher likelihood of staying nice and plump and fluid. So the disc health is what our focus is going to be. The way that we're going to do this is by creating negative pressure in the disc. So if you think about having a disc between two vertebrae, when there is a lift, you're creating a negative pressure in between, almost like a vacuum in between. When you lift, it's going to allow any fluids around the area to be flushed in, and also the disc itself has a gelatinous portion in the middle, and a lot of disc herniations or disc protrusions have that gelatinous portion kind of squished out the back. So when I create the space, when the decompression table creates the space, that vacuum, it can actually pull that gelatinous material back in and take pressure off of nerves and off of the spinal cord itself. So not only is it creating disc health by increasing movement and helping decrease all that fixation, it's also actually allowing the disc to stay as full and plump as it can, pull in the hydration around it, and also pull in any part of the disc that may have squished in one direction or another. So when you have that decreased pressure in the disc, it's going to decrease inflammation, because as it pulls fluid in, with the next motion it's going to flush fluid out, which is going to send inflammation away from the area. Inflammation is many times what's causing that chronic pain. When you have inflammation just sitting around the joint, that's many times the actual true root of the cause of pain. So by decreasing that inflammation over time, we are decreasing your body's likelihood of creating DDD, which is degenerative disc disease. Degenerative disc disease means that the disc has worn down over time. Disease just means that it's progressive by nature, and without intervention, it's going to continue to get worse. So this is a good intervention to help plump that disc back up. That degeneration is where the pad wears down and the bones almost become bone on bone, and then it's really hard to make progress in a non-surgical route. So this is a great intervention prior to surgery. This is a great alternative to actually restore that health in a natural way. So by creating that space, we're decreasing that bone-on-bone type sensation by creating space, allowing the disc to stay plump, and also sucking in that herniated disc if that is the case. So in this image over here, you can see this is the back portion of the disc. This is what each vertebra sits on top of. They all kind of stack. We're looking like aerial view here. So when this gelatinous portion of the middle protrudes out or herniates out the side, it's putting pressure on the nerves coming out of here, which is where you start to get that numb and tingle sensation down the back of the leg, wrapping around the front to the groin. Any of that is because a nerve is getting pinched. So by creating space, lifting the pressure off here, it actually creates a vacuum here and allows that gelatinous portion to get sucked back in to some degree and take pressure off of that nerve. So what we're hoping is, in the office, this is going to allow a great alternative for people who are kind of at the end of the road between chiropractic and surgery. This is going to be kind of a Hail Mary situation to take pressure off of the discs and allow people to hopefully prevent such procedures. It is also good proactively though. So it can be used reactively once the disc is already protruded or we're kind of in a situation where we're at the end of the road, last alternative, but it's also really good for people who are active, for weightlifters, for anyone who's loading their spine every day, just like gravity does day in and day out. Really good to create space in that disc so that you're not in a situation where you're having those bulging discs. So this is really good for anyone with a spine, anyone interacting with gravity on a daily basis. I would assume that's probably you. But also especially those people who are having those degenerative disc type issues. So we will talk through each of your specific care plans and what's recommended for each of you as it's needed. But this is just kind of a general